So allergy shots are something we're going to talk a lot about in the afternoon. And allergy shots work best for patients with allergic asthma, allergic rhinoconjunctivitis, and we're going to talk about some of the indications later. But one of the recent Cochrane reviews have really showed that immunotherapy is beneficial in our patients with asthma. So it reduces asthma medicines, it improves symptom scores, it decreases allergen-specific bronchial reactivity, and then there are some non-specific decreased bronchial reactivity as well. So immunotherapy can be very beneficial in our patients with allergic asthma. Now, where it gets difficult in patients with severe asthma is one of the things for patients with asthma is we want their asthma under relatively good control before we start allergy injections. And those with very severe forms of asthma, we have to weigh the risks and the benefits. So for most patients with allergic asthma, immunotherapy is extremely beneficial if they have allergic asthma. In those with severe forms, we really have to weigh the pros and cons. And many times we start immunotherapy on those patients. Sometimes we have to do Xolair, or we sometimes mix Xolair with allergen immunotherapy. So Xolair is a really good option for those patients that have allergic asthma that is moderate to severe persistent asthma. So it's basically an injectable drug that's anti-IgE. It is used for kids and adults greater than 12 with moderate to severe persistent asthma who have allergies, whose weight and IgE are within dosing limits. And so for some of our patients, this can be, the difficult factor is they have allergic asthma, they have really high IgEs, and sometimes that can be outside the dosing range. And so those are some challenging patients. But for those patients that have allergic asthma, this can be a really important treatment tool. So Xolair is injected either every 2 weeks or 4 weeks, and it's just based on dosing, based on their weight and total IgE. And the way Xolair works, it's basically like a sponge that absorbs all the allergic antibodies. And by doing that, it down-regulates the IgE receptors on allergic cells like basophils and mast cells. And by doing all of this, it can reduce asthma and allergy symptoms. And so numerous studies have shown that it reduces the occurrence of exacerbations. It allows many patients to have reduced steroid use, as well as a lot of other important markers of asthma control. Now, what are the side effects? So these are injections. Most people tolerate them very well, but injection site reactions, if there is going to be a side effect, is one of the more common one. And then pain at the injection site, and some patients have some fatigue afterward. Now, some of the early reports of Xolair highlighted the concern for malignancy. There was a 0.5% of malignancies in the Xolair-treated group in some of the initial reports versus 0.2% in the placebo. But this isn't a tremendous difference. And the other thing is that this was in a less than 1 year observation period. So if Xolair were to cause a malignancy, we would expect it would take longer than 1 year to have that clinically observable. And so follow-up studies looking at over 10,000 people have failed to show that a significant increase in malignancies. And so that concern has really quieted down recently. Now, it's important to understand that Xolair is an injectable drug, and like a lot of injectable drugs, there's a risk of an allergic reaction. So there is a subset of patients that have anaphylaxis to Xolair, both right at the time as well as hours later. And this can occur both on the first injection and injections weeks or months or years into therapy. And so our patients that are getting Xolair are monitored in a medical facility. So this isn't something that would be done in the home. And then patients that go on Xolair, some of the other barriers include cost. So this is definitely an expensive therapy. It's reserved for those with more severe forms of asthma, with allergic asthma. And it's really important to try a 4 to 6 month trial to figure out if they're going to get better. So one of the main things is that there is a differential response. People tend to either get better or they don't. And those patients with allergic asthma can do a lot better. So I have a 13-year-old patient that has had asthma for years. He was on 6 to 7 oral steroid courses in the last year. He had to quit football. He was using his rescue inhaler all the time. He was on the highest dose inhaled corticosteroid in LABA, and he had allergies. He was placed on Xolair and has had dramatic improvement. So since he's been on it for the last 6 months, he's rejoined athletic sports. He has no longer had any prednisone in the last 6 months. So there are patients like that respond really well, but not everybody does that. And so when you're thinking of a really expensive medication, you really want to make sure that you're targeting it to the right person, allergic asthma, and then you're reassessing to make sure that they're actually responding.